it's a particular honor to be joining you today. I've been at the University of Miami for 3 years, and one of the first things I learned was how important your fundraising is to the Cancer Center down there. And so it's actually very nice to come and meet the people. I know many of you are survivors, people who have family that are afflicted with the burden of cancer. And what we're trying to do is to now move forward to the next 20 years of targeted therapies. When we talk about it, therapies and chemotherapy, you think that what have we been doing for the last 40 years? Well, we essentially took something we had no idea about how it forms. Tumorigenesis, which you heard in the introduction, is the process of going from a normal cell to a tumor. And it seems like cancer just happens, but it's a long process. Multi-pathways are affected in our bodies, and to combat it is going to take an amount of knowledge and a way to attack those particular pathways with specific drugs. Now, in the last, let's say 10, 15 years, we've been able to now use not only small molecule drugs that specifically target what's broken in the cell. We've been able to use antibodies and other novel biologicals. So our repertoire, our toolbox, is growing daily. And our technologies are allowing us to attack specific proteins. Now, in our laboratory, what you heard earlier was we work on a protein called Notch. And so for 15 years, we've been trying to figure out what this protein does. So, many of you, sit in your kitchen and you have bananas and you have your fruit flies flying around them and you want to swat them and get rid of them. But what you don't realize is how much we know about cancer came from studying fruit flies. The gene that we work on, Notch, was first identified in the fruit fly. And there's essentially 3 proteins that form a critical component of our body during development. These are called, they all have funny names. One is Wnt, one is hedgehog, and one is Notch. And these proteins work together to form our very bodies from early embryogenesis. And what happens is they become reactivated in the tumor. So you might have a mutation in something that many of you may have heard of, like EGFR or something like that. And there's a mutation in that gene that's driving tumorigenesis, but then these other proteins come on. And so what we're trying to do, and what molecular oncology is to identify those critical proteins that the tumor depends on, and try to find the ones that are common, whether it's breast, esophagus, or pancreas, and try to figure out then how to attack it. And so in our laboratory, in our program, what we try to do is looking at individual tumors for some specific reasons, but then looking at, in general, the tumors to see, for example, which tumors are dependent on Notch. Turns out most tumors are dependent on Notch. Most tumors are dependent on hedgehog. If you can target those, then you have a better chance of taking that tumor down. Now, a very important paradigm, and I think explains why we're having so much trouble combating cancer as a management issue. The paradigm comes from AIDS, from HIV research. Now, when you look at the virus, HIV, it has a very limited set of genes, maybe 10 that are important. And what you hear is that you have this cocktail that has specific inhibitors to just 3 proteins. And that targeting those 3 proteins is what keeps the viral load down. Because what happens is if you attack one of the genes, the virus mutates and you become resistant to that particular gene, that drug. And so it's a never-ending cycle if you just try to target one drug. The same is true for cancer, but it's much more complex. We maybe have 20 to 50 genes that are contributing to tumorigenesis. We might have inhibitors to just a few of them, which in the next 20 years will grow rapidly, I'm sure. Now, what we want to be able to do then is to figure out how to make a similar type of paradigm work for cancer, where we can attack, let's say, Notch, EGF receptor, and some other component that is necessary. And in that way, get away from chemotherapy, which is obviously anyone who's seen someone go through chemotherapy or has gone through chemotherapy, it's not what we want to be treating people with. So hopefully we can get to a point where the treatment of cancer is subtle and specific. And that way we can eradicate the disease. And it's your efforts and your fundraising and the funds that come from the PAP Corps that really make a difference. We're in a critical time in basic research. The NIH, which is funding 90% of what we do, has been flatlined for the last 10 years. That means that every year we're losing more and more research dollars. And now we're at a point where you can see we can make big strides, but the resources are being held back. And so we don't have the resources we need to make the big leaps that we need to do. So it's much more important, and now today, that your fundraising efforts continue, and it's going to be the lifeblood of our research.